Hi, my name is Seth Bittker, and I appreciate this opportunity to tell you about our paper, Acetaminophen, Antibiotics, Ear Infection, Breastfeeding, Vitamin D Drops, and Autism, an Epidemiological Study. My co-author on this work is Kathleen Bell. A number of risk factors have been considered for autism spectrum disorder, ASD. Most of the existing research in this area examines prenatal or perinatal factors. We felt it could be fruitful to consider postnatal variables that may affect risk of ASD as well. Thus, we focused this research on a set of 6 postnatal variables and 1 prenatal variable. We constructed an internet-based survey focused on these variables and demographics. We then recruited parents to take this survey using social media, the Interactive Autism Network, listservs, and friends of participants. After exclusions, we had a data set consisting of 1,001 cases and 514 controls. The cases had ASD with no known genetic conditions. The controls did not have ASD or related conditions. There were some demographic differences between the case and control groups. These differences could be explained based on the construction of the survey and what is known about ASD epidemiology. We then used logistic regressions adjusted for demographic variables and found some associations. Specifically, we found that postnatal acetaminophen, postnatal antibiotics, and postnatal ear infection are all associated with increased risk of ASD. Longer duration of breastfeeding is associated with decreased risk of ASD. In an analgesic model, we found that acetaminophen is weakly associated with ASD, but ibuprofen is not. Similarly, in a joint antibiotic ear infection model, antibiotics are associated with ASD, but ear infection is not. In a joint breastfeeding vitamin D drop model, breastfeeding dominates, but vitamin D drops have a weak association with ASD. This weak association is in the opposite direction of what has been hypothesized in much of the existing literature. Takeaways. Postnatal acetaminophen, postnatal antibiotics, and ear infection are all associated with increased risk of ASD. Association with antibiotics is stronger than ear infection. Breastfeeding is associated with decreased risk of ASD. Vitamin D drops are weakly associated with ASD when adjusted for breastfeeding. These results have practical implications and should be considered when formulating practice guidelines. Acknowledgements. We are very grateful to Columbia University's Interdisciplinary Center for Innovative Theory and Empirics, INSIGHT, for research support. We are also grateful to the Interactive Autism Network, IAN, for its generous assistance with subject recruitment.